Question number 1.
The exact cause of Alzheimer's disease is not fully understood. However, changes in the brain are evident in a patient with this disease. Select all that apply. 1. Destruction of the myelin sheath on the neuron. 2. Development of beta-amyloid plaques in between neurons. 3. Creation of neurofibrillary tangles within the neuron. 4. Destruction of dopaminergic neurons. A. 1, 2 and 4. B. 1 and 4. C. 2 and 3. D. 4 only. The correct answer is letter C, 2 and 3. Alzheimer's disease is mainly caused by development of beta-amyloid plaques in between neurons and creation of neurofibrillary tangles within the neuron.
Rationale for incorrect answers.
Destruction of the myelin sheath on the neuron is related to multiple sclerosis. Dopaminergic neurons are neurons responsible for producing dopamine that is used by our nervous system to send messages between nerve cells. Due to some risk factors such as age, genetics and toxins causes these dopaminergic neurons to die, which is associated with Parkinson's disease.
Question number 2.
A neuron is made up of a cell body which contains the nucleus. In addition, it has dendrites which functions as A. Take information it receives away from the cell body. B. To receive information for other nerve cells and take that information to the cell body. C. Give structure to the cell body and help keep the neuron functioning. D. Release neurotransmitters at the synaptic junctions to relay messages. The correct answer is letter B. To receive information for other nerve cells and take that information to the cell body. Neurons are composed of 8 major parts, mainly dendrites, designed to receive communications from other cells. They resemble a tree-like structure forming projections that become stimulated by other neurons and conduct the electrochemical charge to the cell body. Nucleus, the central area where all the neuronal protein synthesis takes place. This contains the genetic material of the neuron. Soma, also known as a cell body, is the core section of the neuron which maintains the neuron structure and provides energy to drive activities. Schwann cell are the one that produce the myelin sheath around neuronal axons for its protection. The nodes of Ranvier are regions in the axonal membrane that are not insulated by myelin in order to facilitate rapid conduction of nerve impulses. Axon, also called nerve fiber, portion of a neuron that carries nerve impulses away from the cell body. The axonal terminals are specialized to release the neurotransmitters of the presynaptic cell to the receiving neuron.
Question number 3.
Which tests below can a patient have to check for beta-amyloid proteins in the brain? Select all that apply. 1. X-ray. 2. MRI scan. 3. Spinal tap, lumbar puncture. 4. PET scan. Letter A 1 and 2. B 2 and 4. C 1 and 4. D 3 and 4. The correct answer is letter D, 3 and 4. A test that measures amyloid levels in cerebrospinal fluid can accurately identify most patients with Alzheimer's disease. Positron emission tomography, also known as PET scans, are used to measure the buildup of abnormal amyloid protein in the brain, which is one of the key hallmarks of Alzheimer's disease.
Question number 4.
A patient with Alzheimer's disease is having trouble performing the movements needed to use their toothbrush for mouth care. This is described as A. Aphasia, B. Apraxia, C. Anomia, D. Agnosia. The correct answer is letter B. Apraxia. This is characterized by difficulty in performing daily tasks even if the instructions are understood. Accurate motor skills are mainly affected. Examples: difficulty tying shoelace, difficulty in dressing, difficulty in making certain facial expressions. Aphasia, communication disorder that impairs a person's ability to process language and communication. Written and verbal skills are mainly affected. Examples: tip of the tongue experiences, diminished ability to write or writing the wrong word, hesitancy in speaking. Anomia is a type of aphasia specifically unable to name basic objects or people. Examples: patient is having difficulty naming the object that is used in cutting papers. Patient is having difficulty naming her mom on the picture. Agnosia, loss of the ability to identify objects using one or more senses. Examples: patient smells an orange but can't identify it. Patient hears the tick of the clock but can't name it.
Question number 5.
During the evening hours, you noticed your patient with Alzheimer's disease, middle stage, begins to increase in agitation, confusion, and hallucinations. What nursing intervention could the nurse implement to help decrease this occurrence? A. Provide the patient with coffee at bedtime for him to be relaxed. B. Provide a low-noise environment in the evening. C. Stimulate distractions at night for him to get tired and take rest. D. Limit patient's contact with sunlight during the day. The correct answer is letter B. Provide a low-noise environment in the evening. The scenario described is called sundowner syndrome. This is also known as late-day confusion. One possibility is that Alzheimer's-related brain changes can affect a person's biological clock, leading to confused sleep-wake cycles. Nursing management. Music therapy. Keep familiar objects such as family photos nearby. Ensure your loved one has adequate lighting in their environment during the day and darkness at bedtime.
Rationale for incorrect answers.
Here are the don'ts in patient with sundowner syndrome. Providing the patient with coffee at bedtime for him to be relaxed will make the patient unable to sleep on scheduled time. Stimulate distractions at night for him to get tired and take rest, which may just cause further agitation. Limit patient's contact with sunlight during the day can lead to changes in body clock of the patient. Unpredictable and unorganized schedule of activities makes the patient's body routine confused.
Question number 6.
The nurse is helping a patient with moderate Alzheimer's disease, middle stage, participate in a task. When selecting a task for the patient, the nurse would want to make sure the task is A. Clear, simple directions. B. Involves multiple steps to enhance ability. C. Critical thinking. D. Use of multiple tools for daily practice. The correct answer is letter A. Clear and simple directions. Here are the doses for patients with moderate Alzheimer's disease. Provide a clear, simple directions. Try to keep a routine, such as bathing, dressing, and eating at the same time each day. Help the person write down to-do lists, appointments, and events in a notebook or calendar. Speak calmly. Listen to his or her concerns and frustrations. Avoid multiple or prolonged naps during the day.
Question number 7.
You're providing education to a group of caregivers about wandering and Alzheimer's disease. You ask the participants to verbalize signs a family member with this disease may be experiencing wandering. Which sign verbalized by a participant requires re-education? A. The family member takes longer than expected to return from a place. B. The family member repeatedly requests to visit an old friend. C. The family member refuses to leave their bedroom. D. The family member has trouble finding rooms within the house. The correct answer is letter C. The family member refuses to leave their bedroom. Wandering or being lost is a common behavior in patients with Alzheimer's disease. This behavior can be very distressing for caregivers and dangerous for the individual. Here are the common practices that you should do for patients at risk for wandering. Do not leave the patient alone. Display signs throughout the house to identify the rooms. Consider a GPS tracking device system for the patient. Make sure the person carries some kind of ID or wears a medical bracelet. If the person gets lost and can't communicate clearly, an ID will let others know about his or her illness, including the person to contact.
Question number 8.
The patient with Alzheimer's disease, middle stage, is sitting in the bedside chair and is about to eat breakfast. Which action by the nurse demonstrates the nurse knows how to communicate with this patient correctly? A. The nurse approaches the patient from behind to initiate conversation. B. The nurse asks, "Do you want orange juice with breakfast?" C. The nurse leaves the TV on while talking with the patient. D. The nurse stands over the patient while conversing with the patient. The correct answer is letter B. The nurse asks, "Do you want orange juice with breakfast?" This is a closed-ended question which is advisable to do with patients with Alzheimer's disease. There are the common do's and don'ts to patients with Alzheimer's disease. Ask closed-ended questions to avoid difficulty answering. Open-ended questions might trigger agitation as it will give them pressure to think. Approaching from front side instead of approaching from behind. This will prevent them from being anxious of being attacked from behind. Give time to speak, think, and never interrupt during the speech. Eye-level conversation instead of below or above eye-level conversation to give them comfort of communication. Do not exclude them from conversation. Isolating them will make them feel inferior than others that can trigger behavioral issues. One question at a time. Bombarding them with questions can cause confusion and agitation.
Question number 9.
A patient with Alzheimer's disease is prescribed a cholinesterase inhibitor. Which of the following medications below is not this type of medication? A. Razidine, galantamine. B. Exelon, rivastigmine. C. Donepezil, D. Namenda, memantine. The correct answer is letter D. Namenda, memantine. Galantamine, rivastigmine and donepezil belongs to category of cholinesterase inhibitor, while memantine belongs to NMDA antagonist. So how does it work? Here we have the transmitting neuron and the receiving neuron. Acetylcholine helps neurons to communicate, sustain attention, responsible for our senses, learning and remembering things. When neurons communicate with each other, acetylcholine binds to the receptors of the receiving neurons. However, with the presence of acetylcholinesterase, it breaks down acetylcholine into acetic acid and choline. This leads to shortage of acetylcholine during the process. Now here comes your cholinesterase inhibitor, which is your galantamine, rivastigmine and donepezil. It targets acetylcholinesterase so that there will be sufficient amount of acetylcholine that can travel to the receptors of the receiving neurons. On the other hand, we have your Namenda that has a generic name of memantine. These are classified as NMDA antagonist, short name for N-methyl D-aspartate. So how does this drug works? In between two communicating neurons is a synapse where calcium ions are readily available for neural activity. Glial cells produce glutamate, which serves as the key for the receptors for the calcium to enter the neuron. With the presence of beta-amyloid plaques for people with Alzheimer's disease, glial cells are triggered to produce more glutamate than normal levels. This keeps the receptors open and massive entry of calcium happens, leading to cell death. Here comes the role of memantine. It targets the glutamate so that there will only be adequate supply in order to prevent too much entry of calcium into the neurons, preventing cell death. How many correct answers did you get? I know you got it all correctly, but wait, don't forget to hit on subscribe button and turn on notification bell so that you will be notified for upcoming videos. You can also share this to your friends. Goodbye.